Hi, I'm Shanna and I'm going to be doing the head, ears, eyes, nose, and throat assessment using my daughter, Abby. So first, Abby, I'm going to start with asking you some questions. Have you been having any headaches? Any problems with your vision?
No.
Any pain in your eyes or anything coming out of them?
No.
What about your nose? Any stuffy or runny nose? And how's your hearing?
Great.
And any pain in your ears or anything coming out of your ears?
Mm-hmm.
Wonderful. Any pain in your sinuses, here or here? And then how about your mouth, nose, or throat? I mean your mouth and your throat?
No.
Nothing. Okay, very good. So first I'm going to assess your head. So we're going to start with your hair. So I'm going to assess Abby's hair, and her hair, she has a full head of hair, no bald spots. It's very strong, it's soft, it's clean, no knits. And I'm going to assess her scalp. So her scalp is white, there's no flakiness noted. Again, no bald spots, and so her scalp is fine. Next I'm going to look at her face. So her face is symmetrical. There's no edema, no swelling, no tics, no, and her facial movements are appropriate. And I forgot to assess her skull. So her skull, I don't feel any lumps or bumps and no obvious deformities. So head is good. All right, Abby, so now we're gonna talk about your eyes. So before you came in, you did a Snellen test to check your visual acuity. And then you also did the Jaeger and Rosenbaum test to assess for near vision. That checked out fine. So then we're gonna look at your eyes. Just sit up straight, there you go. So your eyes are aligned, they're placed proportionately in your skull. Let's see, then we're gonna look at your eyebrows, and they're nice and full, no scaliness, no bald spots. And looking at your eyelids, so first they close, very good, and there's no sores or anything, no edema on her eyelids, and her eyelashes are nice and full, very good. Now I'm going to have you look up so that I can assess the sclera and the conjunctiva of your eye. Nice, the sclera is white, the conjunctiva is pink. If I was going to assess the conjunctiva of her upper lid, I would take a Q-tip, hold it here, and pull her eyelashes over, and but we've agreed not to do that. So next I will look at the corneas, and the corneas are clear, no opacities. And then I'm looking at her irises, and her irises are brown. And then to check for narrow angle glaucoma, I can shine a light in the corner of her eye and look for a shadow on the opposite side, and I don't notice any, so no glaucoma. Next I'm going to check her pupils. So first I note that your pupils, it's kind of dark in here, so your pupils are about 4 millimeters at this point, and they're equal. Now I'm going to shine a light, and I'm going to check directly in this eye what happens to this eye. So I expect your eye to constrict. If I do so, which it does, I'll try the other side. Very good. Now I'm going to shine the light in this eye and see what happens in this eye, and that is called a consensual reaction. So we'll shine a light here, and we'll watch for the other eye. Very good. A little dark in here, but yes, there is a reaction. So that's appropriate. Now I'm going to check for accommodation. So Abby, follow my finger, and as we do so, I'm watching her pupils, and they should constrict as we get closer, and they do. All right, now we're going to look for extraocular movement. So I'm going to shine a light in between your eyes and look to see that the light shines equally on either side, which it does. Next, I'm going to do the cover test. So, Abby, I'm going to have you look at the mirror behind me, and just keep looking back there. And I'm going to cover one of your eyes, and I'm going to look to see if the other eye moves. Okay, so no movement, no movement. Very good. Let me just shut my light off here. And so now we're going to check the cranial nerves. All right. So I'm going to have you look towards my fingers. All right. So here, first here, and down here, and over here, here, and here. Very good. All right. And we're going to check your field of vision. So I'm going to have you cover your right eye. And I'm going to close my left eye. And we're going to look at each other with these two eyes. And I'm going to hold up fingers, and I'm going to do it in 4 quadrants. So you're going to tell me how many fingers I'm holding up, okay? All right, so here we go. My eyes closed. So
2, 1, 2, 1.
Very good. And now we're going to change eyes, okay? So we'll change eyes. I'm going to close this eye. All right, Abby.
2, 1, 2, 1.
Very good. All right, so her visual field is intact. All right, so next I'm going to check the retina. And if I was going to check the retina, I would use the ophthalmoscope, which I don't have, and I would shine it into her eye, and I'd be looking for the red reflex in the back of her eye. But I don't have one, so we will not do that. So we're going to move now to your ears, all right? So I'm going to start with a couple tests for you, all right? So I'm going to get behind you, and I'm going to have you cover this ear here, and I'm going to whisper 3 words into your ear, and I want you to then repeat the words that I whisper, okay?
Okay.
All right.
1, 2, 3.
Great. And then I try the other side. And a little close here.
2, 3, 4.
Great, perfect. And then another test for her hearing would be the Weber test, and that's where you would strike a tuning fork. You would put it on the top of her head and then ask her which ears she could hear the sound in. Hopefully she'd hear them in both. And then also we could do the Renee test where you would strike, I'll get on this side, strike the tuning fork. You would place it on the mastoid bone and ask you to signal to me when you no longer heard the sound. I would then move it to the front of your ear and ask you again to signal to me when you no longer heard the sound. The expectation is that you would hear it twice as long in front than you would in the back. All right? Now looking at your ears, your auricle's perfect. Your tragus is fine. Your ears look great. Nothing's coming out of them. I don't notice any cerumen. And I can look into the external auditory meatus, and I don't see anything there. I would then take the otoscope and look towards into her ear, and I might have to position her ear appropriately to open up the canal. And I would be looking at the tympanic membrane, and I'd be assessing for redness or swelling. And I would also be looking for the cone of light to reflect. All right, so let's see if we're done with the ears. All right, so we're gonna move on to the nose. All right, so for the nose, I notice that her nose is straight. The nasal passages are not flaring. And I'm just gonna check and make sure you can breathe out of each nostril, okay? So I'm gonna close this one. Can you breathe okay? Out of the other side?
Mm-hmm.
Okay, and now this side? Very good. All right, we can also use a scent to make sure that her smelling is intact, but we don't have that now. And I would also use the otoscope to look up into her nose at the mucous membranes and make sure there's no deviated septum. All right, now we also check your sinuses. So we have the frontal sinuses and up here sinuses. Very good. All right, now we are going to move on to the mouth. And first for the mouth, I'm looking at your lips. Your lips are pink, they're not cracked, there's no sores on them. Then I'm gonna have you stick out your tongue for me. Her tongue is pink, the papillae are are present as expected. There's stick out, and it's midline. There's no shifting of her tongue. I could then manipulate her tongue and look underneath. I would also look at the buccal mucosa. You can put your tongue back in. So we look at the buccal mucosa of her mouth, and it's all good. We could use our pen light to shine light if needed. And then we look at her teeth, and her teeth are there's a couple missing, which isn't surprising based on her age, but there's no loose teeth noted. And then again, I'm going to have you stick out your tongue, just do an ah. And so I'm looking at the soft palate, and it's even, present. And then the uvula is rising appropriately, and it's midline. It's not swollen. And look to the back of the throat, the pharynx. Again, no redness. Her tonsils are pink. There are some crypts, but there's no exudate present. All right, good. All right, so that's your mouth. We could also use a tongue depressor. She sticks out her tongue very well, so you can see. But if we needed to, we could use a tongue depressor to press down to look better. We could also use a tongue depressor to check her gag reflex, but we agreed not to do that also. And let's see, also need to check your temporal mandibular joint. So I'm just going to have you open and close. Very good. So the joint moves evenly on both sides. There's no clicking or crepitus. Very good. All right. Next, sorry, I am going to check your neck. All right. So looking at her neck, the trachea appears to be midline and not shifted. One way to assess for that is that you're able to put your finger on both sides in between the trachea and the sternocleidomastoid muscle, and which is present. Then we need to check the thyroid. So you can palpate the thyroid in the front. You could shift the trachea over, which compresses the trachea. So we shifted the trachea. We could feel for the thyroid here, but I'm not going to do that with her delicate little neck. And so that's the anterior approach. The posterior approach, you would stand behind the patient, and I would ask her to swallow as I roll my fingers out towards that sternocleidomastoid muscle and assess the trachea in that way. Okay, very good. And then I'm going to feel for your lymph nodes. So we have the preauricular, the posterior auricular, the tonsillar, the submandibular, the submental, the occipital, the superficial cervical, the deep cervical chain, the posterior cervical, and the supraclavicular. And to check for that, I would put my fingers here on either side and just ask you to take in a deep breath, which would force them up if they were swollen. The last thing we need to do, Abby, is to listen to your neck. And so if the thyroid was swollen, you might be able to hear a bruit within the thyroid. And we're also going to listen to her carotids. Now a bruit would indicate turbulent blood flow. So let me just listen here. So listen to the thyroid. I don't hear anything. And then over on both sides. And I don't hear any thrill or bruit. All right, Abby. So we have looked at your head, ears, eyes, nose, mouth, neck, throat. So everything looks great. So thank you, Abby. All right, and that's it for our assessment. Thank you.